Let me start with something that'll probably make you feel a lot better. If you're over 60 and noticing your urine stream isn't quite what it used to be, you're definitely not alone. In fact, you're in the company of millions of people who are experiencing the exact same thing. And here's the really good news. This is one of those health issues that we actually understand pretty well, and there are genuinely effective solutions that can make a real difference in your daily life. I know it might feel a bit embarrassing to even think about, let alone talk about, but trust me, your doctor has heard about this hundreds of times, and once you understand what's going on and what you can do about it, you'll probably wish you'd looked into it sooner. So let's have an honest, straightforward conversation about this, just like we're sitting down over coffee. Why does this happen? Let's talk about your plumbing. Think of your urinary system like the plumbing in an old house. When everything's new, water flows freely through the pipes. But over time, things change. For men especially, there's a walnut-sized gland called the prostate that sits right below the bladder, wrapped around the urethra. That's the tube that carries urine out of your body. Now here's the thing about the prostate. It keeps growing throughout your life. I know, seems like a design flaw, right? By the time you hit 60, that walnut might be more like a small lemon. This condition is called benign prostatic hyperplasia, or BPH for short. Benign just means it's not cancer, and hyperplasia is the fancy medical term for growing bigger than it should. Imagine trying to drink a milkshake through a straw, and someone's pinching that straw. That's essentially what's happening when your enlarged prostate presses on your urethra. The bladder is working just as hard as ever, but the exit route has gotten narrower. Result? A weaker stream, and sometimes it takes longer to get started, like an old engine that needs a few tries before it turns over. For women, the story's a bit different, but equally common. After menopause, lower estrogen levels can cause the tissues around the urethra and bladder to become weaker and less elastic. The pelvic floor muscles, think of them as a hammock supporting your bladder, can also weaken over time, especially if you've had children. This can lead to a condition called urethral prolapse or general pelvic floor weakness, which affects how forcefully urine comes out. How do you know if it's just aging or something to address? Here's where I want you to pay attention, because this is important. Some changes are pretty normal, but others are your body's way of waving a red flag. Normal aging changes might include needing an extra few seconds to get started, or noticing the stream isn't quite as forceful as it was in your 30s. Maybe you're getting up once a night to use the bathroom instead of sleeping straight through. But it's definitely time to talk to your doctor if you're getting up 3, 4, or more times every night. You have to push or strain to get urine flowing. The stream stops and starts multiple times. You feel like your bladder never fully empties. You're planning your entire day around bathroom locations. You've had any episodes where you couldn't urinate at all. That's an emergency, by the way. There's pain, burning, or blood in your urine. That last one especially. If you can't urinate at all, that's called urinary retention, and you need to get to a doctor or emergency room right away. It's rare, but it can happen, and it needs immediate attention. What else could be going on? Before we get into solutions, let's talk about other things that might be contributing to this issue, because understanding the full picture helps you and your doctor figure out the best approach. Medications are sneaky culprits. If you're taking antihistamines for allergies, decongestants for a stuffy nose, certain antidepressants, or medications for overactive bladder, ironically, these can all affect urination. Some blood pressure medications and muscle relaxants can too. It doesn't mean you need to stop taking them, just that your doctor needs to know what you're on. Urinary tract infections aren't just for young women. Older adults get them too, and they can make everything feel off down there. If your weak stream comes with burning, urgency, or cloudy urine, infection might be the issue. Diabetes that's not well controlled can damage the nerves that tell your bladder when to squeeze and when to relax. If you're diabetic and noticing urinary changes, definitely mention this to your doctor. Neurological conditions like Parkinson's disease, multiple sclerosis, or even a previous stroke can affect the nerve signals between your brain and bladder. The plumbing might be fine, but the control system isn't working right. Bladder stones, or less commonly, bladder or prostate cancer, can also cause these symptoms. I don't want to scare you. Most weak streams aren't cancer, but this is exactly why you should get checked out rather than just hoping it'll go away. The doctor. Visit. What to expect. It's really not that bad. I know. Doctor visits aren't anyone's favorite activity, but modern medicine has come a long way, and the evaluation for urinary problems is pretty straightforward. Your doctor will probably start with questions. When did you first notice changes? How many times do you urinate during the day and night? Any pain or blood? What medications are you taking? Have you noticed any patterns? Like, is it worse at certain times? Then comes the physical exam. For men, yes. This includes a digital rectal exam where the doctor feels your prostate through the rectum. It takes about 10 seconds, and while it's not comfortable, it's not painful either. For women, it might include a pelvic exam to check for prolapse or other structural issues. You'll almost certainly give a urine sample. This checks for infection, blood, or other abnormalities. They might also do a test where you urinate into a special toilet that measures how fast your stream is and how much comes out.